It all started here, deep in the forest of Guinea, with this man's son. Scientists call the baby in this picture Patient Zero, the first human to get Ebola in West Africa. For Chen Umuna, this is Emile, his 2-year-old son, who used to love playing football. Scientists suspect Emile got the virus by touching an Ebola-infected bat in the forest. Children here hunt and eat them. Emile passed Ebola to his mother, who passed it on to his sister, who passed it on to his grandmother, and so on, until more than 28,000 people, mostly in West Africa, were infected.
Ebola came here in our little village. Then the white men and the government came and visited and made big promises, but nothing has changed. Ebola has destroyed us.
The outbreak was not a war, but it certainly felt like one. The virus shattered lives, tore families apart, wiping out entire generations and leaving children orphaned. Survivors suffer from neurological problems and are treated as outcasts. It's in Liberia's densely populated capital, Monrovia, where Ebola spread faster than anywhere else in the world. Doctors Without Borders treatment units were submerged. The organization took the unprecedented decision to call the military for help.
People who had red eyes, who were vomiting, who had diarrhea, who presented symptoms of Ebola were brought here. They were separated from their families, and if they were tested positive, they were brought in tents that were laid out here. It was called the hot zone. This is where doctors and nurses wearing full protective gear would treat Ebola patients. So many Liberians lost their lives here. And the Ministry of Health are dismantling this treatment center, saying there's no need for it. Ebola is no longer a problem.
And yet the virus is still in the environment, in animals, but also in survivors who carry it in their semen, eyes, and nervous system. As long as they don't have symptoms, they are not contagious. Doctors like Phil Ireland, who survived Ebola himself, are now testing a new vaccine on survivors. It has shown positive results.
We give them Ebola. It's not the one that will develop the disease. And then the body immune system, the soldiers in the body, learn how to fight the Ebola. So when they get the Ebola from the environment, okay, the body already know how to fight the disease and defeats the disease.
Health experts warn the risk of another outbreak is likely. Where and how it will come, no one really knows. Nicolas, Haque, Jazeera, Monrovia.